Assalamualaikum and hi everyone. My name is Muhammad Faiz bin Zulkpeli. I am a final year student in University Science Malaysia. I'm studying in physics and majoring in medical physics. So in this video, I will share with all of you about non-contact infrared thermal imaging for diagnosing type 2 diabetes. Let's start. I am sorry, but you are such a liar if you say that you never heard of a disease called diabetes before. I mean, look at this. But still, I will tell you about the scientific definition of diabetes mellitus. Diabetes mellitus is a chronic disorder of glucose metabolism with serious clinical consequences. Just to make it short, diabetes can be classified into two main types, which are type 1 and type 2 diabetes. Type 2 diabetes accounting for the majority, which more than 85% of total diabetes percentage. Type 1 diabetes don't produce insulin, while type 2 diabetes still produce insulin, but they don't make enough of insulin, or the insulin was not used efficiently. Type 2 diabetes is a lifelong disease that keeps your body from using insulin the way it should, and older people are most likely to diagnose with type 2 diabetes. But the disease also can affect kids and teens, mainly because of childhood obesity. Thermal imaging camera used to detect infrared radiation and translate it into a temperature reading. Thermal camera have several advantages compared to an infrared thermometer, such as the one used when we want to enter supermarket during COVID-19 pandemic. A thermal imaging camera gives you temperature reading for each pixel of the entire thermal image and allow you to visualize an entire scene in thermal. The question is, how non-contact infrared thermal imaging used to diagnose type 2 diabetes? Infrared thermography is the process of using a thermal imager to detect heat coming from an object by converting it to temperature and displaying an image of the temperature distribution. I am going to talk about the potential of infrared thermography in diagnosing and predicting type 2 diabetes by set biochemical assay of HbA1c as standard. HbA1c is a blood test that is used to help diagnose and monitor people with diabetes by showing the amount of glucose attached to hemoglobin over the past 3 months. Just to make it short, there are two important steps to understand, which are biochemical analysis and thermal measurement. For biochemical analysis, the blood sample collected from an individual was used to obtain the various biochemical parameters, specifically HbA1c, which was determined from the whole blood using Olympus autoanalyzer. For thermal measurement, the thermal image was captured at a distance of 3 feet from the various body region such as hand. Then the image were analyzed using a thermal software such as Quick Report software. This software used must provide the setting for object parameter like emissivity, reflected apparent temperature, atmospheric temperature, which can be manually entered. Then the obtained thermogram result may vary due to the human physical conditions such as fever, cardiovascular disease, and thyroid dysfunction. This picture shows the thermogram of the palm region of a control and diabetic subject. In a non-diabetic subject, the skin temperature of the palm indicates 35.2 degrees Celsius. This can be due to the normal metabolic function of the body and good perfusion of the blood, whereas in a diabetic subject, the palm temperature indicates 33.0 degrees Celsius, which was lower when compared to the control subject. This may be due to the poor blood perfusion and decreased metabolism. The advantages of this method are non-invasive, free risk, less time, and inexpensive when compared to other imaging modalities. And the disadvantages is an advanced image processing tools may be incorporated to obtain a better result with higher accuracy because there might be slightly deviation in the skin temperature calculation. In conclusion, skin temperature enable early detection of diabetes as compared to HbA1c. As HbA1c increase, skin temperature decrease. The decrease in skin temperature may be due to the decrease in the basal metabolic rate, poor blood perfusion, and high insulin resistance. Thermography can be used as a diagnostic as well as prognostic tools for the diabetes. And that's all from me. Thank you. Bye.